Hi guys, my name is Emily Arias, and I worked for Family Heritage in 2009. I worked as a Family Heritage agent for about a year. I got into Family Heritage because John Fierro had come over and sold me a cancer and accident policy for my family. I had just had a baby. I was working in a restaurant as a server, and the supplemental insurance made a lot of good sense, especially because I had a job that was labor intensive, and I knew that if I ever got hurt that I would have no disability pay, those kinds of things. So from the minute John showed me the policies, I knew that it was a product that we wanted for our family, but also he knew that having a new baby at that time, that I was looking for a way to do something more with my life and get out of the restaurant business. And so he presented me with the Family Heritage kind of business opportunity, and I was definitely into that as well. And so for a year, I worked with Family Heritage. I was mildly successful. I don't think I ever was at the top of any statistic boards, but I definitely gave it my all and went on a lot of train mores. We did some good travel. I really just learned how to cold call and knock on doors and do sales pitches and all those things. And after a year, I just realized it wasn't the right fit for me, that the sales, the door-to-door, it just wasn't something that I could do year-round, and it wasn't something that I was successful enough at to really support my family. So I took that success that limited success that I had, but the skills that I learned at Family Heritage, and I applied for a position with a company called Cardin Outreach to be a patient advocate. And in my interview with them, I sort of, I didn't really tell them what Family Heritage was. I didn't just say that I went door to door and sold insurance, but I was able to talk about the other skills that I learned on the customer service aspect, the sales, the insurance part of it, talking about people with their health situations and helping them think about how to prepare for times of need and all of that. And that interview landed me the job. So in 2009, I went from Family Heritage to working as a patient advocate. I guarantee you, without the Family Heritage experience, I probably wouldn't have gotten that job. What Cardin Outreach does is we go help people at hospitals who don't have any insurance and are already admitted to the hospital, and we help them apply for things like medical assistance in Minnesota Care and insurances to help cover their hospital bills. So I went to do that job, and I will say in the first 6 months of being a patient advocate, I was wildly successful. I essentially, with my new job after Family Heritage, I was knocking on doors, but they were hospital doors, and I was cold calling on patients, but they were for a different purpose. And my skills from Family Heritage really helped me to do those things really quickly and really successfully. So within 6 months of working at Cardin Outreach, I was promoted to be the project manager for the Minneapolis area. And after a couple of years of doing that, I moved over to work for Allina Health as a revenue cycle manager. Same thing, helping people without insurance get on insurance, but I was managing a larger department at that time, teaching Family Heritage skills to a lot of patient advocates, teaching them kind of sales talks, convincing patients to want to work with us, how to explain benefits, how to explain policies, how to cold call on hospital doors, get over those nerves, how to be assumptive. I can't think of how many times I've had to talk to people about being assumptive, talking about law of averages, when looking at our advocate success rates. So many of the things that come out of my mouth on a daily basis at work are skills and life lessons that I learned in Family Heritage. So then actually in 2013, we still had our Family Heritage cancer and ICU policy, and we had our second child, Jonas, and he was born with some medical issues, and he spent 60 days in the ICU. So not only had my Family Heritage skills sort of really gotten me somewhere with a career, but then when my son got sick, it ended up paying us about $14,000 for everything that he went through. And the one thing about when Jonas was sick was that as much as it was really hard, and it was really hard having a newborn that had so many issues going on, we never worried about finances once. And people would kind of ask us about money and worry about us. And I had a couple of people send us some money in the mail, but we really didn't need it because we knew at the end we were going to get a check from Family Heritage. So yet again, Family Heritage helped us out, not just in a professional level, but on a personal level. And then most recently, Cardin Outreach called me back and said, we have an executive director position open and we'd like to have you come back and manage an entire region. So just in January of this year, I took another promotion. I'm back at Cardin Outreach and I'm now executive director over Minnesota, Wisconsin, North Dakota, South Dakota, and Iowa. And I can say when I left Family Heritage, yes, there was great income possibility. And you should all give it at least a year of your life and give it your all and see what you can make of it. But when I left Family Heritage, I went down to a salary of about $40,000 a year with benefits and paid vacation and that kind of stuff. And in less than 5 years, I've now worked my way into an executive director position, and I've more than doubled that starting salary. So we're now making, a lot more money as a family. And while I couldn't make the big bucks that some people who have a lot of success with Family Heritage do, the skills I learned at Family Heritage still have led me in a very short time period to a really successful career. And I still think back fondly on my time at Family Heritage and all the things that I taught. Just in my office right now that I work out of in Minneapolis, I'm helping one of my project managers learn how to train her staff. They're really bad at making phone calls and sort of that cold calling aspect. So once again, we're pulling out the Family Heritage skills and trying to teach them how to, even as patient advocates and helping people, get on assistance, which is a free thing to the patients. It doesn't cost them anything. You still have to do sort of a sales talk and convince them that they should work with us and that they need the help, because it's hard for people to see that. So I had a great time at Family Heritage. It was a year of a lot of ups and downs, a lot of hard work. I learned a lot about myself and what motivates me and what doesn't, and what I can potentially do in a kind of a very self-reflective year, I think, that I had with them. And it's taken me really far. So I wish you all luck. John Fierro is still a good friend of mine, even though we don't work together anymore. And by all means, if anyone ever has any questions or needs any advice, I still like to keep in touch with people from Family Heritage. So have a great rest of your training, and just good luck to you all. Give it everything you can, and take everything possible away from your experiences. Thanks, guys. Bye.